Hi there, my name's Antonia Ho. I'm an infectious disease doctor and an epidemiologist. For those of you who don't know what an epidemiologist is, we study basically how diseases affect the health of population. So before COVID-19, I used to study influenza, and particularly the type of groups of patients who get more serious disease, and that allows us to really target treatments such as medication, but also prevention like vaccines, for example. And how did I get into this job? Well, when I was in medical school, I spent a summer working in Malawi. And that's a small landlocked country. You can see there a long, thin country in green there, which is surrounded by Zambia, Mozambique, and Tanzania. It's a very beautiful country, but also one of the poorest countries in the world, with lots of other infections such as malaria, tuberculosis, and HIV. Also, healthcare systems there are very limited. I was really inspired after spending a summer there. So I decided to become a doctor specializing in infectious disease and tropical medicine. Also decided that I wanted to do some research in order to gain some skills to understand really how disease affects particular people and how we can better design kind of interventions to manage these infections better. So I did a PhD in Malawi for 3 years studying flu. So that's what I did before COVID. Since 2020, I've been running studies both in the UK and Malawi, understanding more about COVID-19. In the UK, I work on the ISARIC 4C study. So this is a big national study recruiting patients who are admitted to hospital with COVID-19. And I oversee the recruitment in Scotland. So there are teams of research nurses across hospitals in Scotland who are enrolling patients, asking them very detailed information, recording these details, and also taking samples such as blood samples as well as nasal swabs so that we can better understand how the virus affects the body, and in particular in people who get serious infection. So this study has now recruited over 70,000 patients and is really one of the largest studies in the world recruiting COVID patients. I'm also running a study in Malawi. Along with Malawi researchers, we're trying to understand whether healthcare workers, so that includes doctors, nurses, physiotherapists, pharmacists, whether healthcare workers in Malawi are at increased risk of getting COVID compared to the general public. The reason being that healthcare workers are obviously at the front line and seeing lots of patients who are sick. And in hospitals in Malawi, they don't necessarily have facilities that we have in the UK, such as running water, alcohol gel, or even personal protective equipment, such as face shields, face masks, and gowns, for example. So yeah, that's what I've been up to over the last 5 months.